Obesity is a perilous disease which is overtaking the United States as a whole, but also the numerous states and cities within. 20 states now have an adult obesity rate at or above 30%. This figure is astounding considering the Huffington Post indicated 20 years ago there is not a state that had above a 15% obesity rate. The comparison exhibits the necessity for assistance managing the condition. Being more specific, the adult obesity rate in Kentucky is 33%. Not to mention the adult obesity rate in Davis County is 31%. Obesity can lead to many medical conditions, including heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable death. In 2008, medical costs associated with obesity were estimated at $147 billion. The medical costs for people who are obese were $1,429 higher than those of normal weight. Children are a major focus of marketing in food and advertising health. Many organizations and schools are targeting children and starting their health education young. Early childhood obesity rates in Davis County is 14.3%. Advertising has a major role in food choices people make today, especially in children. The moment a McDonald's commercial plays on the television, there are eye-catching toys associated with the food to catch children's attention. Consequently, children are more enticed to eat at McDonald's for the sake of receiving a nice toy. The Kaiser Family Foundation monitored 13 television programs between May and September 2005 and discovered 2,613 featuring food drinks pointed towards teens and children. Those statistics prove the tremendous impact television has on children. During the teen years of growing up, children are starting to make their own decisions and develop their own opinions. Displaying the plentiful junk food commercials could easily persuade the teens to fall into the trap of fast food. On the other hand, adults are also tempted to eat at unhealthy restaurants also, sometimes unconsciously. Advertising for food and beverages communicates potentially powerful food consumption cues, including images of attractive models eating, snacking at non-meal times, and positive emotions linked to food consumption. These commercials make people want to eat at the specific restaurant on the grounds that person in the commercial was happy, and so maybe the food will make them happy. While there are various commercials about junk food, healthier options such as salad, sandwiches, and fruit are rarely seen in commercials. Today, making sure that children are healthy and fit are major concerns in the school system, especially in elementary schools. If children are taught how to make healthy eating choices and healthy exercise decisions at a young age, they will carry these over as they get older. Teaching children about these qualities in elementary will instill these habits in their lives forever. Making children aware of these habits now will make the choices a second nature, and the children will not know any different. Schools are starting to become more involved in making sure children are exercising and eating the right foods. Many schools are cutting out Coke machines during school hours, as well as changing the lunch menu in order to assist the students in making smarter eating decisions. These decisions are a great way to start changing the eating habits of students, but the habits need to be carried over into the home to have a lasting effect. Owensboro Health, starting in 2015, offered free membership to the health park employees at a discounted rate to their families. My mom, as an employee, and I, as a daughter, have greatly benefited from these opportunities. How has the health park free membership helped you and your employees?
Well, it has allowed my employees who otherwise could not afford to go to the gym, it has allowed them to come to the health park and work out with them and their family and to improve their health.
The one particular person in the community is Collette Carter. Collette shared a lot of helpful information. Okay, since you are an expert in the field of public health, can you explain why you're interested in obesity in particular?
Well, I was lucky enough to grow up with a family that was very focused on health and wellness. It's something that we, really made part of our life every day. I didn't recognize it till I'm older of the value of having a mother that cooked well and made sure we didn't have a lot of junk food and those things in our pantry, so that we were always eating healthier foods. And we also was very active. I've been an athlete all my life. I was a dancer for 14 years, so I've always been physically active and, carried that on into my adulthood and even teaching my children to be active because I know the importance of, staying healthy and making good health choices.
Collette also shared that there are many community resources that could help people become healthier, such as the health park, YMCA, church facilities, the Greenbelt, farmers markets, and the riverfront. Along with nationwide organizations, there are also local groups that support getting fit. Healthy Horizons is a local community partnership committed to improving health by communicating and addressing local priority health needs. Collette Carter shared the goal of the organization was to resolute commitment to a healthy community. The program has inspired people to participate in various activities, one being Get Movin'. According to Carter, Get Movin' was a 6-week program that focused on cardiovascular activity. The activity aided various community people with becoming active and realizing that exercising can be fun. Programs such as these help promote the health of the community and hopefully start spreading the word statewide and even nationwide.